Having high poise is, in many cases, seen as something to be thankful for. It's accepted to be vital to progress in numerous parts of life, whether that is getting an advancement at work, adhering to your exercise routine, or opposing the enticement of a sweet treat while you're watching what you eat. In any case, as recommended by a hypothesis distributed by teacher Thomas Lynch in 2018, high poise may not generally be something to be thankful for, and for some purposes, it varies well and may be connected to specific emotional wellness issues. As indicated by Lynch's hypothesis, each and every one of us is inclined more toward one of two character styles, taking care of or over-controlling. The manner in which we will quite often incline relies upon many variables, including our qualities, the ways of behaving that individuals around us reward and deter our background, and the survival techniques we use in our daily existence. Critically, being under-controlled or over-controlled is neither great nor awful. While it makes us bound to act with a specific goal in mind, a large portion of us are mentally adaptable and can adjust to the various circumstances we're placed in. Thus, whether or not we're over-controlled or under-controlled, this adaptability assists us with managing life's difficulties and misfortunes in a helpful manner. We trust specialists. We accept that information should illuminate choices. However, both under-control and over-control can become dangerous. This generally happens when a mix of organic, social, and individual elements makes us significantly less adaptable. A large portion of us are presumably more acquainted with what tricky caretaking resembles. Individuals who are exceptionally under-controlled may have few hindrances and battle to get a handle on their feelings. Their way of behaving might be unusual, as it's generally expected based on the mindset they're in. This can adversely influence their connections, instruction, work, funds, and well-being. There are numerous treatments out there that can help under-controlled individuals. These treatments assist them with figuring out how to direct feelings and increase discretion. For instance, mental conduct treatment expects to show individuals command over their viewpoints, ways of behaving, and feelings. Also, persuasive conduct treatment, intended for individuals who experience serious feelings, targets feelings of dysregulation. Hazardous over-control. Tragically, over-control isn't discussed much. This might be on the grounds that over-controlled attributes, for example, steadiness, the capacity to make arrangements and stick to them, taking a stab at flawlessness, and being in charge of feelings, are in many cases exceptionally respected in our general public. Be that as it may, when over-control turns into an issue, it very well may be harmful in numerous everyday issues. Profoundly over-controlled individuals might battle to adjust to change. They might be less open to new encounters and analysis and be extremely stuck in a rut. They might encounter unpleasant sensations of jealousy towards others and battle to unwind and have a great time in friendly circumstances. They may likewise utilize fewer signals, seldom grin or cry, and attempt to conceal their feelings at any expense. Together, these qualities might make an individual bound to encounter social disengagement and forlornness. This may at last cause their psychological wellness to decline. Tragically, a considerable number of the accessible mental treatments aren't useful in that frame of mind of over-control. This is on the grounds that they center around working on discretion and feeling guidelines. Yet, since over-controlled individuals now control and manage excessively, they need treatment that can assist them in discovering that occasionally it's okay to unwind and give up. Close to his hypothesis, Lynch likewise fostered a treatment intended to treat issues of over-control, known as profoundly open rationalistic conduct treatment. Early investigations have shown that the treatment has a ton of potential for aiding over-controlled individuals. It does this by showing them how to relinquish the need to continuously be in charge, be more open about their feelings, better speak with others, and be more adaptable amidst evolving circumstances. Critically, this treatment is transdiagnostic, and that implies it very well may be useful, paying little mind to what emotional wellness condition an individual could have been determined to have previously. Research shows that it very well might be valuable for individuals who battle with a range of emotional well-being conditions. For example, treatment-safe melancholy, anorexia nervosa, and chemical imbalance issues. However, to get reasonable assistance, an individual must initially be accurately recognized as profoundly over-controlled. The ongoing evaluation of overcontrol is very lengthy and complex. It includes a couple of polls and a meeting that should be led by an exceptionally prepared clinician. This can restrict access to help and dial back research. I'm dealing with fostering a worked-on evaluation technique that will help speedily recognize tricky overcontrol. This will make it simpler for analysts to keep examining overcontrol as well. High poise is normally appreciated, and exceptionally overcontrolled individuals are seldom open about their battles. That is why dangerous overcontrol can slip through the cracks for quite a while. Proceeding with work in this field will ideally make it simpler for individuals to get the assistance they require. Critically, overcontrol and undercontrol are perplexing ideas that can't be self-analyzed. On the off chance that you suspect you might be exceptionally overcontrolled or undercontrolled, and particularly in the event that it's influencing your well-being and prosperity, it means a lot to connect with a specialist or specialists. If you like the video, please press the like icon and subscribe to the channel.